Yesterday, you learned about the decades-long struggle with my right knee and how I no longer had a choice but to replace the joint. Today, I bring you my personal journey to the hospital for a behind-the-scenes look at my total knee replacement surgery. We must warn you that the video is real footage from the operation, and although we blurred out some shots, parts of the story contain graphic images.
Account numbers and the amount that's paid and what's out of pay and what needs to be paid. I've taken care of everything.
It's been 2 months since I first learned I would need a total knee replacement. Time enough to prepare all of the paperwork, my finances, and prep my 2 sons who would be my primary caretakers. Yet here I was on the morning of the operation going over everything with them. This after getting up at 4 a.m. for my 7:30 surgery. What was I thinking? At the moment, all that's running through my head are the risks of the surgery.
So it's still big surgery, so you still worry about bleeding, worry about blood clots, worry about infection, worry about stiffness. So those we all address very aggressively. Anesthesia does have its own set of risks, but again, these days with regional anesthesia, spinals and things like that, it's really at a minimum.
After checking in at Northwest Hospital in Randallstown, I'm brought to a back room to prep for the operation.
So there's 2 wipes. We want everything wiped down.
For 3 days prior to surgery, I was given a special soap to bathe with every night. From the beginning, it's clear that the risk of infection is taken quite seriously. After vitals are taken in an IV set, my surgeon arrives.
Dr. Polsky,
nice to meet you. He tells my sons what to expect during the operation, how to care for their mother afterward, and most important, how to spot signs of infection. He then signs his initials on my knee, a standard practice to make sure the correct limb is operated on.
I'll come talk to you guys as soon as I'm done, okay? And then you'll be able to see her probably about an hour later. Okay?
The first few nights at home, it's going to be important to have people around so there's no falling, people are safe getting around, going to the bathroom, basic necessities.
And now it's time to head into the operating room. When I walk in and see the various drill bits lined up on the table, I almost pass out without painkillers. Kidding aside, I decide on a spinal instead of general anesthesia to get me up on my feet faster. I'll still be sedated through the procedure, but only numbed from the waist down. Once the anesthesia takes effect, my arms are strapped outward to prevent them from getting in the way of the surgery. The whole team must use protective clothing, some with what's known as surgical spacesuits. Even my photographer had to scrub in. Once the incision is made, scissors are used to cut tissue and sutures. Drilling is to help guide the screw placements. Saws are for bone cuts. A hammer is used to choose which size implant best fits my knee. Veins are then cauterized to stop the bleeding, and suction is used to clean out the area.
The metal parts are permanent, they don't wear at all, but the plastic part can wear out. Nowadays, the plastic parts we use are 25 plus years.
The whole operation takes about an hour and 20 minutes and about another hour in recovery.
So they tell me I've been out of surgery now in the recovery room for about an hour. They're hoping to get me up on my feet really soon. I think I got a shot of the little balloons on my legs. They keep pumping so that I don't end up with blood clots. That's the main concern. Pneumonia, they don't want me to be laying down like this too long, prevent pneumonia.
2 hours after the operation, I'm wheeled into my hospital room where my sons are waiting.
So they did something really interesting. They inserted Q-tips with betadine up my nose to prevent MRSA.
I fill them in on the details, at least what I remember. A technician then comes into the room to take an x-ray of my new bionic knee. From this point on, I will set off those metal detectors at the airport. Physical therapy begins almost immediately. Just 2 hours after surgery ends, I'm on my feet for the first time, a bit wobbly, but walking nonetheless.
Put your hands back to sit. That's okay.
Okay.
Good.
Oh, do I need a leg lift?
No.
When I first started, they used to bring folks in a couple nights before the procedure and prepare them for the procedure. Nowadays, it's 1, maybe 2 nights in the hospital. And there's actually, I've even done 1 patient outpatient. If they're safe and they're eating and drinking and pain's under control, they can go home.
I stayed 3 days and 2 nights at Northwest before heading home to begin the toughest part, rehabilitation. And for 3 days afterward, I feel like Superwoman and make great strides in recovery, but then the anesthesia wears off. So join me tomorrow for the final segment of my series where I take you through the first 2 weeks of my rehab.